Hi, my name is Shanae Justice, and this is Ayala Trout. And today we're going to do shoulder horizontal adduction. Hi, Ayala. How are you? Good. All right. What we're going to do is we're going to assess your shoulder horizontal adduction. We're going to start with having you sit upright at 90 degrees. I'm going to have you bring your shoulder to abduction and flex your elbow to 90 degrees. And your forearm should be in mid position, as it is. Okay? What we're going to do is place the goniometer axis on the axis of the acromion process. I'm going to stabilize at the scapula in the trunk, and the stationary arm is going to be perpendicular to her trunk. The movable arm will be parallel to her humerus. What I'm going to have you do is move your arm inward towards your chest. This is assessing her active range of motion. The result is 105 degrees. I'm going to passively move her inward. And the result is 125 degrees. The functional range for shoulder horizontal adduction is 0 to 135 degrees. Relax. Shoulder horizontal adduction occurs in the transverse plane along the vertical axis. Functional activities that occur using this motion including washing your axilla, which requires 104 degrees of range of motion. Combing your hair requires 54 degrees of range of motion, and eating requires 87 degrees of range of motion. Any limitations to this motion can be due to pain, injury, or inflammation.
Hello, my name is Colin Sawashik, and we have
Shanae Justice.
And we're here to show you shoulder horizontal abduction. First, I'm going to show you active and passive range of motion assessments. First thing first, I'm going to ask our patient to sit in an upright position, abduct her shoulder to 90 degrees, flex her elbow to 90 degrees, and ensure that her arm remains at 90 degrees. Using your goniometer, I'm going to place the axis of the goniometer just above the acromion process. The stationary arm is to remain perpendicular to the trunk, and the movable arm is going to remain parallel to the longitudinal axis of the humerus. So, I'm going to ask our patient to abduct her shoulder as far as she can. So please abduct your shoulder. I'm going to use the movable arm to follow the humerus. Now, this is active range of motion. I'm going to apply a bit of force to continue past this active range of motion to get our passive range of motion. So I'm going to a bit more force. Tell me when to stop.
All right.
Okay, that's it. All right, this is our passive range of motion. Normal range of motion for active and passive. Normal active is from 0 to about 45 degrees. What I've gotten from hers was 0 to 30, and for her passive, I got 0 to 45. So she's around in the ballpark. The shoulder is a ball and socket joint. It moves through all planes and all axes. However, right now we're talking about shoulder horizontal abduction. For this movement, the shoulder is going to move through the horizontal plane and rotate around the vertical axis. There are a lot of applications or functional applications for horizontal abduction. For example, opening and closing a window. Another one, washing the axilla. Maybe reaching up your back. However, there are things that might limit this, such as pain or fractures.
Okay, hello, I'm Ayala, and this is Collins, and we're going to be performing the elbow extension and flexion range of motion. So to start, the elbow is a hinged joint that goes through the sagittal plane and the frontal axis. To measure Collins' range of motion, I'm going to place a towel under his humerus. This will allow for full extension so it doesn't get hit by the plinth over here. The normal range of motion for elbow flexion is 0 to 150 degrees, and for extension is 150 to 0 degrees. Alright, to start, we're going to have the patient in supine. The arm is extended, and so I'm going to place the goniometer on Colin's arm. So the axis should be on the lateral epicondyle, right here. The stationary arm should be parallel So longitudinal axis here and pointing to the acromion process. So feel that right here. And the movable arm be also along the longitudinal axis along the radius pointing to the styloid process, which is right here. Make sure that's all lined up before you begin. I'm going to stabilize on Colin's humerus here, and also my distal hand placement will be on the distal ulnar radius over here. So I'm going to have Collins move his hand from extension to flexion. So say, Collins, please move your hand to flexion. And is that all you can go? And before I even read the measurements, I'm going to check that everything's still lined up, so it's still on the acromion pointing toward the acromion process, and on the lateral epicondyle, and pointing to the styloid process. And then I can take the measurement. And then I can passively, for passive range of motion, see as far as you can go. So I can go? It's exactly 0 to 150 degrees. And he was basically, active range of motion was 0 to 149 degrees. An alternate position for measuring active and passive range of motion for elbow extension and elbow flexion. So a patient will be sitting instead of lying supine, but everything else basically goes the same. So we have the goniometer. I'm going to place it on the lateral epicondyle over here. The stationary arm is going to be on the longitudinal axis pointing towards his acromion process. I can feel that over here. And the movable arm will be along the radius pointing towards the styloid process over here. I'm going to hold and stabilize on the humerus as well as my distal hand placement on the ulnar and radius. So I could have Colin flex his arm number, and it's 0 to 140 degrees. And then I'm going to passively flex Colin's elbow a little further to get 0 to 150 degrees. Now for elbow extension, I have, again, his arm is going to be flexed. The goniometer placement axis is on the lateral epicondyle. The stationary arm is going to be on the longitudinal axis pointing towards the acromion process. And the movable arm is going to be along here the radius pointing towards the styloid process. And then I'm going to have Colin stabilize my humerus. Stabilize his humerus right here and hold on to the distal hand placement over here and say, Collins, can you please extend your arm for me as much as you can go? Good, and that was active range. To measure elbow extension, I'm going to have Collins in a flex position here. I'm going to place the goniometer axis at the lateral epicondyle, and the stationary arm is along the longitudinal axis pointing towards the acromion process, and the movable arm is along the radius pointing towards the styloid process. I'm going to have Collins, and then I'm going to stabilize the humerus over here, and my distal hand is going to go on the ulnar and the radius over here. I'm going to have Collins extend his arm. Good. There are many self-care activities that can be done within the range of 30 to 130 degrees of flexion, such as pouring a drink or reading a newspaper. Within the range also of 45 to 136 degrees of flexion, there's also eating and drinking. Tying a shoe requires 16 degrees of flexion. Getting up from a chair requires 15 degrees of flexion, while walking with crutches, playing tennis, and throwing a ball all require extension.
Now we're going to be performing shoulder horizontal adduction, manual muscle testing against gravity. So my patient will be lying in supine. I will have her abduct her shoulder to 90 degrees. Her elbow will be flexed to 90 degrees. I will palpate the pectoralis major, the primary muscle responsible for this motion. I will instruct my patient to adduct towards her chest. Right. And I will apply resistance on the anterior aspect of the arm. I'm going to apply resistance, just don't let me move you. The client was able to hold this position with maximum resistance, so she would get graded a 5 out of 5. Alrighty, now we're going to do shoulder horizontal adduction, gravity eliminated. So what you're going to have your client do is sit upright in the chair at 90 degrees. We're going to have her abduct her shoulder to 90 degrees as well, and flex her elbow to 90 degrees as well. And what I'm going to do is I'm going to support her arm, and my other arm will be on her scapula to stabilize her trunk. So what the client will do is she will adduct towards her chest, and I will support her in the entire movement. And because she was able to complete this motion, full range of motion, in a gravity eliminated plane, she will get a 2 out of 5.
Now I'm going to ask our patient to bring her arm down and make sure that it's about at 75 degrees from her trunk. And her elbow is flexed about 90 degrees. I'm going to stabilize the scapula. I'm going to ask her to abduct her shoulder. So can you lift up your arm? And I'll be palpating for the posterior deltoid. Bring it back down. Because the posterior deltoids are primarily responsible for horizontal abduction at this angle. So one more time. Thank you very much. And I can see my client has very, very strong posterior deltoids. So for manual muscle testing, now I'm going to put a bit of pressure to the lateral aspect of her humerus, and then I'm going to apply resistance, and I'll tell her not to allow me to push down on her arm. So lift up your yeah, there you go. One more time. All right. And that is manual muscle testing for shoulder horizontal. I'm going to give her 5/5 because I used as much pressure as I could apply, and she was able to resist it.
Go.
Okay, now I'm going to show you horizontal abduction of the shoulder, manual muscle testing with gravity eliminated. First, I'm going to have our patient to sit upright again. I'm going to ask her to support her forearm and support the scapula. Ensure that the elbow is flexed at 90 degrees and the shoulder is abducted to 90 degrees as well. Now I'm going to ask our patient to try to abduct her shoulder as much as she can. So can you try to move your shoulder as far back? Okay. There you go. Thank you. Okay. It's eliminated. The highest you can get on the manual muscle testing scale is a 2, which she was able to complete the range of motion with gravity eliminated. So I'll give her a 2.
Hi, I'm going to be performing manual muscle testing for elbow flexion against gravity, and we're looking at the biceps brachii. So I have my patient here lying in supine with his elbow flexed and the forearm is supinated. And I'm going to stabilize here at the humerus. I'm going to palpate in the antecubital fossa of the biceps and have him flex his arm in the full range of motion. So please flex your arm, and I can feel the muscles here. Then I'm going to apply resistance to his anterior aspect of his forearm in the direction of extension and forward pronation while he tries to flex his arm. I'm going to say, don't let me move you. Good. Good job. Okay, good job. And we would grade this as 5 out of 5. I will be demonstrating manual muscle testing for gravity eliminated for elbow flexion using the biceps brachii. So I have my patient sitting with his arm supported on a table. His shoulders should be abducted at 90 degrees and his arm is extended and the forearm is supinated. I'm going to stabilize here at the humerus and palpating here at the biceps. I'm going to ask him to flex through the full range of motion. So please flex. So since he was able to complete the full range of motion, gravity eliminated, I would grade this as a 2/5. Manual muscle testing for elbow extension against gravity with the triceps. So you have a patient here lying in supine. His shoulder is going to be flexed and internally rotated. And his elbow is also going to be flexed and the forearm is supinated. I'm going to stabilize here at the humerus and palpate at the olecranon process. I'm going to ask my patient to extend through the full range of motion. Good. Then I'm going to apply resistance on the posterior aspect of his forearm. And I'm going to apply resistance in the direction of flexion while he extends his arm. Don't let me push you down. Good. Okay. I would give him a 5 out of 5 on the manual muscle testing scale since he held his position against maximum resistance. I'll be performing manual muscle testing for elbow extension with gravity eliminated. So I have my patient sitting down and his arm is supported on a table. His shoulder is abducted and his elbow is going to be flexed to 90 degrees. I'm going to stabilize here at the humerus, and I'm going to have him extend his arm through the full range of motion while palpating back here at the olecranon process. So please extend your arm. Good. Since he was able to extend through the full range of motion with gravity eliminated, I would grade this as a 2 out of 5 on the manual muscle testing scale.